Hello future RNs, let's study with K. So in previous lecture I told you about what are all the categories of nclex examination. So in this lecture I will briefly explain you that what all are the topics and questions that are very important for these all categories. So the first one is health promotion and maintenance. Here I am having total 33 number of topics that I will cover for your topics for this category. 1. Acute kidney injury. 2. Anatomical and clinical parts of teeth. 3. Antibiotics and overview. 4. Cardiovascular assessment. 5. Colic. 6. Different types of lung sounds. 7. Diuretics. 8. DNA. 9. Electrical conduction system of the heart. 10. Energy. 11. Enzymes. 12. Vital heart rate. 13. Fluid and electrolyte balance. 14. Gastroenterological drugs. 15. General adaptation syndrome. 16. Genes and alleles. 17. Glaucoma and cataracts. 18. Glucose tolerance test. 19. Heart anatomy and physiology. 20. Heart blood flow. 21. Hypertension. 22. Immunomodulators and immunosuppressive agents. 23. Infant torch syndrome. 24. Meningitis. 25. Mitosis. 26. Nausea and vomiting during cancer treatment. 27. Pacemaker care. 28. Pernicious anemia. 29. Pleural effusion. 30. Proper skin assessment. 31. Pulmonary circuit. 32. Seizure. And 33. The nervous system. So the next one is physiological integrity. In this I am having total 58 topics to be covered for this category. 1. ACE inhibitors and ARs. 2. Addison disease. 3. AIDS infection and malignancies. 4. Amino acids. 5. Antipsychotic drugs. 6. Anti-epileptic drugs. 7. Antihypertensive drugs. 8. Antiplatelet and thrombolytics. 9. Blood gas interpretation. 10. Blood transfusions. 11. Calcium channel blockers. 12. Classification of cancer and metastasis. 13. Carbohydrates. 14. Cause and effect of an AV heart block. 15. Cause and symptoms of hearing loss. 16. Cholinergic and anticholinergic drugs. 17. Congestive heart failure. 18. Coronary artery disease. 19. Culling's ulcer. 20. Dehydration. 21. Diabetes mellitus. 22. Diabetes mellitus diet, exercise and medication. 23. Its complications. 24. Diagnostic procedures for GI system. 25. Drug therapy review. 26. DVT prevention and treatment. 27. EKG interpretation, arterial fibrillation and arterial flutter. 28. Endometriosis. 29. GERD. 30. Graves' disease. 31. Guillain-Barré syndrome. 32. Heparin. 33. Hypertension. 34. Hyperthyroidism. 35. Lipids. 36. Lyme disease. 37. Mixing insulin properly. 38. Multiple sclerosis. 39. Myasthenia gravis. 40. Myocardial infarctions. 41. Newborn cord blood gases. 42. Nursing care of arterial lines. 43. Osteoporosis. 44. Otitis media. 45. Overview of strokes. 46. Pediatric cardiology and cardiac defects. 47. Peptic ulcers and GERD. 48. Pleural effusions. 49. Pneumothorax. 50. Prozac as an antidepressant. 51. Rule of nines. 52. Systemic lupus erythematosus. 53. The coagulation profile. 54. Thoracentesis procedure. 55. Treating wound infections. 56. Turner syndrome. 57. Ulcerative colitis. And 58. Warfarin uses and its side effects. Our next category is safe and effective care environment. In that, I am having total 24 topics to be covered. 1. Calculating IV drip rates, that is dose calculation. 2. Chemical solution. 3. Chest tubes. 4. Common lab values you need to know. 5. Drug suffixes. 6. EKG interpretation. 7. Its ventricular arrhythmias. 8. Intraoperative nursing care. 9. IV fluids. 10. Jaundice lectures. 11. Mechanical ventilation. 12. Newborn Apgar School. 13. Nurse staffing models. 14. Patient advocacy. 15. pH levels. 16. Post-operative care. 17. Pre-operative nursing. 18. Sedative, hypnotics and insomnia management. 19. SOAP notes. 20. Starting an IV. 21. Thrombolytics. 22. Thyroid and antithyroid drugs. 23. Viruses and antiviral drugs. 24. What is HIPAA? Our last category is mnemonics. I have total 3 topics in that to be covered. 1. Mnemonics for heart anatomy and physiology. 2. Mnemonics for medical drugs side effects. 3. Pharmacological mnemonics. So these all are the questions that I have to prepare for my NCLEX examination for scoring good. So let's start preparing with me.